Welcome to this brief video on the Chinese herbal formula called the four-substance decoction with peach kernel and safflower, or Siwu Tang in Chinese. This formula is known for being helpful for fibroids and endometriosis. These conditions are both linked to infertility, and so this formula has also been used to treat certain specific cases of infertility. The formula appears in the important 18th century text, The Golden Mirror of Medical Tradition. This work, commissioned by the Emperor Qianlong, reflects an official consensus on Chinese medicine from that period. However, the formula is first mentioned much earlier in Zhu Danxi's book, The Heart and Essence of Danxi's Methods of Treatment. Textbooks treat Siwu Tang as an addendum to Siwu Tang, as it basically just adds two ingredients. This is unfortunate, as these ingredients change the properties of the formula significantly. Siwu Tang is a relatively mild formula, while Siwu Tang has much stronger actions, involving two active sets of paired herbs. Siwu Tang is classified as a blood tonifying formula. Siwu Tang would better be classified as a formula that invigorates blood and dispels blood stasis. Siwu Tang is translated as the four-substance decoction with peach kernel and safflower. Tao here is an abbreviation for Taoren, meaning peach kernel or persica, and Hong is an abbreviation for Honghua, which is safflower or cardamom. Siwu Tang is the four-substance decoction. It's interesting to compare this formula with Shenghua Tang, or the generating and transforming decoction. The two formulas have three herbs in common: Dangui, Chuanqiong, and Taoren. Shenghua Tang has 5 herbs, and Siwu Tang has 6 herbs. Both formulas are focused on dispelling blood stasis. Their objectives look very similar. They're both active in moving the blood and regulating its circulation. Both formulas expel blood-related masses by breaking up the blood. Of the two formulas, Shenghua Tang puts more emphasis on blood nourishment. Shenghua Tang uses a very large dosage of Dangui with respect to the blood-moving herbs. Dangui is both blood-nourishing and blood-moving, with emphasis on the nourishment. This ties in well with the notion of both clearing and restoring the body after childbirth. On the other hand, in Siwu Tang, the herbs are prescribed in somewhat similar proportions. The predominance of blood-moving herbs would be more appropriate for symptoms indicating fibroids or endometriosis, or for certain types of infertility. Although I speak about these two conditions, you should not use this video for diagnosis, and you should first consult with a health professional if you have one of these problems. Siwu Tang consists of 6 herbs: Dangui or Chinese Angelica root, Shudihuang or cooked Rehmania root, Baishao or white peony root, Chuanqiong or cnidium rhizome, Taoren or peach kernel, and Honghua or cardamom. The herbs are prescribed in more or less equal dosage, apart from Honghua. The dosage of Honghua needs to be adapted according to the required effect, and we'll discuss this later in the video. The formula uses 3 blood tonifying herbs: Dangui, Shudihuang, and Baishao, and 3 blood invigorating herbs: Chuanqiong, Taoren, and Honghua. Plus, to a certain degree, Dangui is also regarded as a blood invigorating herb. Dangui is Chinese Angelica root and has been a popular herb for women even outside China. It has an oily texture and is usually cut into longer, thin strips. Its properties are sweet, acrid, and warm. It is associated with the heart, liver, and spleen channels. You'll remember from the 5 transformation diagram that the sweet property is associated with the spleen channel. The characteristics of Dangui are that it tonifies and invigorates the blood, with more emphasis on tonification. It also regulates menstruation and alleviates or stops pain. You should be careful about using Dangui if the patient suffers from diarrhea and abdominal fullness. The patient may show a tongue with a thick coating, which would imply dampness. You will also need to be careful about using dangui if the patient is taking certain Western medicines or supplements. Shudihuang is Chinese foxglove root that is prepared by mixing with rice wine and steaming until the roots are black and moist. The herbs are then dried in the sun. It has a characteristic overbaked look. The herb is sweet and moist, slightly warm in nature and very cloying. It is associated with the heart, kidney and liver channels. The characteristics of Shudihuang are that it tonifies blood and enriches yin, generates essence and augments the marrow. It should be underlined that Shudihuang is a very cloying and rich substance and can act on the body like a heavy dessert. It can aggravate dampness and impede digestion. It should be used carefully in cases of qi stagnation and excessive phlegm. Baishao is white peony root. It is produced from the roots of cultivated Paeonia lactiflora with the skin removed. Its properties are bitter, sour and mildly cold. It is associated with the liver and spleen channels. You'll remember from the 5 transformations diagram that the sour flavor is associated with the liver. The actions of Baishao are that it tonifies blood and regulates menstruation. It conserves yin and stops sweat. It alleviates pain, nourishes and softens the liver, and stabilizes liver yang. Because Baishao is cold and inhibiting, you should be careful about prescribing it to a patient who has a weak stomach or who suffers from diarrhea. It should not be prescribed for an extended duration. Chuanqiong is Sichuan lovage root or cnidium root. It has a characteristic irregular shape with a darker margin. Its properties are acrid and warm. It acts on the liver, gallbladder and pericardium channels. Its key characteristics are that it invigorates the blood, promotes the movement of qi and expels wind. It is very often used to treat headaches. Chuanqiong should be used with great care during pregnancy, or if the patient bleeds easily or has profuse menses. It should not be used in cases of yin deficiency, where there is general dryness and the patient has a red, dry tongue. Taoren is peach kernel or persica. It is bitter, sweet and neutral. It's associated with the heart, large intestine, liver and lungs. Taoren invigorates the blood to dispel stasis. It is also known as a herb that breaks up blood. That is, it will be used when blood clots are apparent, especially in menses. Additionally, Taoren moistens the intestines to relieve constipation and is used where there is coughing and wheezing. An important point is that Taoren, like almond nuts, contains the compound amygdalin. If taken in excessively large quantities, it can release cyanide, which is toxic. Taoren should be avoided during pregnancy and should be used with care when there is blood deficiency. Honghua is safflower or cardamus. Safflower is one of humanity's oldest crops, now commonly cultivated for its oil. In herbal lore, its red color would immediately associate it with blood. It is acrid and warm and associated with the heart and liver. Honghua invigorates the blood, stimulates menstrual flow, dispels stasis and relieves pain. It should not be used during pregnancy or if there is internal bleeding. The classics say that small doses nourish the blood. Large doses promote blood movement, while overdosage causes continuous bleeding. If we look at a summary of the herbs in the formula, we see that the herbs are predominantly warm in nature. If the diagnosis indicates that cooling herbs are needed, there are many other blood-moving herbs with varying natures and properties that can also be used. We will look more closely at some of these herbs in future videos. All the herbs are associated with the liver. In Chinese medicine, there is a close association between the liver and problems related to women's blood. We can look at dangui and chuanqiong as paired herbs. Dangui is mainly associated with blood tonification or nourishment, and chuanqiong is mainly associated with blood movement or invigoration. Dangui is somewhat oily in texture and tends to moisturize. The dryness of chuanqiong balances the somewhat greasy texture of dangui. When they are used together, they move and invigorate the blood without damaging it. They work well to dispel stasis and stop pain. The other set of paired herbs is Taoren and Honghua. This is a very powerful combination for dispelling stasis and moving blood. Of the two, Taoren is known for breaking up blood, or rather masses which would be associated with blood or menses. In this sense, it is prescribed when the menses have clots, and would also make sense for signs and symptoms indicating fibroids or endometriosis. Taoren's actions are focused on the lower part of the body and the organs. Honghua tends to act more on the upper body and the channels. Honghua opens up the channels to promote blood production and alleviate pain. The action of Honghua varies with its dosage. At very small doses, it engenders and nourishes blood. At low to moderate doses, it harmonizes the blood. At typical doses of 6 to 10 grams, it invigorates the blood. At higher doses, it breaks up blood, and this has to be monitored as it can lead to excessive bleeding. In China, Shenghua Tang is often used to treat fibroids and endometriosis. It is also used in certain cases of infertility, especially when there is irregular menstruation with pain. In TCM, regular menstruation is an important indicator for fertility. The formula has been used for coronary heart disease and for lowering blood cholesterol. The signs and symptoms corresponding to this formula would indicate concurrent blood deficiency and blood stasis. The patient would exhibit pale features, have bouts of dizziness or blurred vision, and would be experiencing abdominal pain. The woman would have an irregular or shortened menstrual cycle. The menses would be dark and sticky and may have clots. The tongue may be pale or purple. The pulse is thin and weak. This is a potent formula, and the practitioner may choose to add other blood-moving herbs. Care should be taken as to the dosage of the blood-moving herbs, especially if there's heavy menstrual flow. The formula should be avoided during pregnancy or if there is internal bleeding. Thank you for watching this video, and I hope you'll join me for future videos in this series.